Okay, so this is your venue. Dito, tong picture na to, it shows you your arteriole. Okay, this is your arteriole. And then, wala na siyang internal elastic lamina. This is your venules naman. And then, the spaces between there are your lymphatics. And then, yung mga maliliit na butas dyan, these are your capillaries. In this picture, letter A, again, this is your arteriole. So, ito yung tunica intima mo, and then tunica media, and then tunica adventitia. Okay? Ano yung mga nasa loob dyan? What gives us a clue na ang tinitignan natin ay isang blood vessel? Okay? Tingnan mo yung loob. Okay? Makikita mo dyan yung mga red blood cells. Yan. Yung mga yan, ito, red blood cells yan. Again, in letter B, arterioles, so they are perfectly circle in shape. So medical application. So since we are talking about blood pressure, di ba? The blood pressure depends on the cardiac output and the total peripheral resistance to blood flow. Again, BP is equal to cardiac output multiplied by your systemic vascular resistance or your total peripheral resistance. So peripheral resistance, it is mostly due to arteriolar resistance, and then hypertension elevated BP is more commonly essential because we have two types of slightly distracting siya, pakimute. Sige. Okay. Sige. So asan na ako? So in your hypertension or elevated BP, it can either be primary hypertension or secondary hypertension. Okay? When you say secondary hypertension kasi, you have an underlying disease. So for example, a very good example here is your pheochromocytoma. Meron kang tumor dun sa adrenal glands which is causing increased blood pressure. Pero in your primary hypertension or your essential hypertension kasi, you don't have an underlying cause. Ang cause mo lang talaga ay masikip yung butas ng mga arteries mo. Okay? So this is due to the wide variety of mechanisms that increase arteriolar constriction. So don't forget this formula for your blood pressure. It can take you very long way. Kahit magme-medicine kayo or pa-practice nyo yung course ninyo, ayan, alalahanin nyo lang to, kapag malakas or malaki yung cardiac output mo, tataas ang BP. Kapag mataas ang systemic vascular resistance, tataas ang BP. Ano ang component ni cardiac output? Your cardiac output is determined by your heart rate and your SV, which is your stroke volume. Ano ba yung stroke volume? It is the amount of blood that is going out of your heart. Okay, so it is affected by your preload, afterload, and contractibility. So lahat ng to, these are not histologically relevant. They are more relevant sa physiology. Okay, so since from arterioles, now let's go to your capillaries. So your capillaries naman, they are the smallest blood vessels, okay? So they permit and regulate metabolic exchange between surrounding tissues, and they always function in groups. Kaya nakikita nyo dito sa picture, ang arteries ninyo, they always appear like this, okay? They always appear in groups. So their function, their size and overall shape conforms to the structure supplied. So for example, ito yung heart, or ito yung kumbaga meron kang organ, which is ito. The shape and structure of your capillaries is ganyan. Parang kumbaga kino-coat niya. Okay? Ganun. And then the richness of capillary networks related to metabolic activity of tissues. Like for example, kapag yung organ mo, it demands or it has a high metabolic rate, like your kidney, liver, and cardiac, yung puso nyo mismo, and as well as skeletal muscles kapag nag-exercise kayo, di ba? So they demand high metabolic rate. So that means they have more capillaries as compared sa mga organs mo naman that doesn't need or has low metabolic rates, like your smooth muscles. Ayan. they have smaller number of your capillaries. So they are supplied preferentially by one or more terminal arterial branches, which are your metarterioles, and continuous with the thoroughfare channels, which are connected with the post-capillary venues. So ano yung mga yan? Ito siya, okay? So ang true capillaries ninyo, sige, ayan. When you say true capillaries, itong mga to, okay? Mga nasa gilid-gilid. The smallest vessels branching from the metarteriole and thoroughfare channel, they lack smooth muscle cells, although pericytes may be present. Okay, your capillaries doesn't have surrounding muscle, okay? Kaya nga hindi sila naapektuhan ng changes in blood pressure. Pero ang mga remnants ng mga smooth muscle cells mo, they became your mga valves or sphincters. Okay? Which are your precapillary sphincters. Ano yung significance niyan? Later. So this one, the significance of your sphincters is that they regulate blood flow into the true capillaries. Okay? So kapag nag-relax yung mga sphincters na yan, instead na yung yung blood mo mag-flow to the thoroughfare channel, nag-relax, dadaan sila ngayon sa true capillaries. Okay, so your capillaries, they are single layer of endothelial cells rolled up as a tube. So they make up 90% of your body's vasculature. Di ba? Napakadami nila. So kapag tinanong kayo, usually ito yung trick question sa sa mga quizzes or mga exams, ano daw yung pinakamaraming blood vessel. Usually nawawala sa isip natin yung capillary kasi nga they are small, di ba? Ang usually sinasagot natin yan, veins, arteries, mga ganun. Pero they actually are the largest in volume. So total length, kapag pinagsama-sama mo lahat yan, they extend to 100,000 kilometers and total surface area of 5,000 square meters. So basically, kung kinombine mo kasi lahat ng capillary mo sa katawan, mas malaki pa yan kesa sa pinakamalaking artery mo. Okay? Or pinakamalaking vein mo. Okay? So, I like to view capillaries as small but terrible, kumbaga. Kahit maliit yan, pero kapag kinombine mo kasi, di ba, hindi naman nag-act yung capillary mo individually. They always act or they always function in groups. Okay? So, ayan. The total surface area, aabot yan ng 5,000 square meters. So there is cyclical opening and closing of the sphincters which essentially empty capillaries at a given time. So the basal lamina helps determine which macromolecule interact with the endothelial cells, and distinctive feature is often the nucleus is curved. So as you can see here, dito sa isang diagrammatic representation ng isang capillary, the nucleus is curved. Bakit? For us to have a wider lumen, okay, para ma-accommodate niya yung passage of your blood. Kasi as you can see here, ang components lang or ang pwedeng dumaan lang dyan ay isang red blood cell at a time. Okay, so yan. So how do nutrients seep out or diffuse from your capillaries? Diba? Since they are the site of nutrient exchange and oxygen exchange. So you have different types of capillaries which will do those function. Okay, you have your sinusoidal or your discontinuous. As you can see here, it has incomplete basement membrane. You have fenestrated capillaries. Ayan, fenestrated. Continuous siya pero marami siyang butas. And then you have your continuous capillary, and then ayan, continuous capillary which has smaller amounts of holes as compared to your fenestrated. Ayan, so your capillaries, your continuous capillaries, they are tight, well-developed occluding junctions between slightly overlapping endothelial cells. And then they are well-regulated metabolic exchange across cells, and then muscles, connective tissues, lungs, exocrine glands, and then your nervous tissue. Okay, so this is the most common capillary actually. So as you can see here, your continuous capillaries, ayan, dire-diretso siya. And then there is continuity along the endothelium. And then your fenestrated naman, they have a sieve-like endothelial cells penetrated by numerous small circular openings or fenestrations which are made up of 80 nanometer diameter. Ayan, yung mga butas na yan. Those are your fenestrations. The basal lamina is continuous and covers the fenestrations. And then organs with rapid interchange of substances between tissues and your blood. So ano yung mga organs or tissues that needs fenestrated capillaries? Those organs that require uh, yung mga organs that disposes, kumbaga. So ano yung mga yon? Kidney, intestines, choroid plexus, which gathers now the waste substances in your cerebrospinal fluid, and then your endocrine glands, because there is interchange of substances between tissues itself and the blood. Okay? So from tissues, yung mga waste doon sa tissues mo, pupunta siya sa blood via your fenestrated capillaries. And then you have your last type of capillaries. You have your discontinuous capillaries. Ano yung distinctive feature nila? They have sinusoids or mga pagitan, kumbaga, or mga one seat apart, ganun. So this is your sinusoids, ito, capillary that has sinusoids. This one is your adipocytes. So they permit maximal exchange, which allow easier movement of cells between tissues and your blood. There is the individual endothelial cells with large perforations without diaphragms, and they collectively form a discontinuous layer with wide irregular spaces between the cells. So ano yung mga organs that need this type of cells or capillaries? Your liver, spleen, kasi nga doon papunta lahat ng mga namatay na platelets natin, ganun. So they would easily go and dispose themselves in your spleen. Some endocrine glands, and saan pa? Bone marrow. Bakit need ng bone marrow ng or discontinuous capillaries? Because your bone marrow produces your blood cells, di ba? Para mas madaling pumasok yung mga blood cells natin doon. Excuse me for a while. Ayan. So let's resume, okay? So reserve your questions for later, ha? Ay, hindi na ako nagtatanong if there are any questions. So ano naman yung mga pericytes? Your pericytes naman, they are mesenchymal cells along continuous capillaries. Medyo umuulan dito. Naririnig nyo naman ako. Clear pa naman. Can I have a thumbs up kung okay pa yung audio ko? Their pericytes, they are mesenchymal cells along continuous capillaries and post-capillary venules. They have a long cytoplasmic processes partly surrounding your endothelial layer, and they produce their own basal lamina which may fuse with the endothelial cells with well-developed networks of myosin, actin, and tropomyosin. So ano yung important function ng pericytes ninyo? Since pericytes, ibig sabihin peri surrounding your endothelium, okay? Or your capillaries. Ito yung mga yon. So this is a capillary, or this one, electromicrograph. Ito yung capillary mo, okay? These are your pericyte. This one. Ito yung basal lamina ng capillary mo. Merong pericyte na nandyan. Anong function ni pericyte, okay? Basically, ang function niya is to have a contractile function, okay? Ibig sabihin, it will also facilitate blood flow of within the cells of your capillaries, okay? So within your central nervous system, the pericytes are important for maintaining the endothelial blood-brain barrier. Okay? So, kung makikita ninyo sa picture, they provide another layer kasi. Okay? They provide another layer sa labas ng capillaries mo. So, in your central nervous system kasi, there needs to be the presence of your blood-brain barrier para hindi makapasok lahat ng mga substances sa blood sa utak. Kasi nga, kapag pinermit niya yon, possible na mapasa yung mga toxic substances sa utak, which is ayaw natin, di ba? So they maintain the endothelial blood-brain barrier. Okay, they also form smooth muscle and other cells in your new vessels kapag nagkaroon ng sugat, kumbaga. Kapag, for example, nasugat ka and then na-trauma yung blood vessels mo, nasira sila, the pericytes will be the one to regenerate yung damaged blood vessels mo. Okay? So sila yung nagpo-produce ng ng vascular endothelial growth factors or your VEGF, ganun, para magkaroon ng angiogenesis or the formation of new blood vessels. Again, this is a picture of your pericytes. This is your blood vessel or your capillary, and then andyan yung pericytes. It surrounds your capillaries. So, medical application of your capillaries. So, hyperglycemia in diabetes, you can have diabetic microangiopathy. Okay, ano to? So, there is diffuse thickening of capillary basal lamina. So kapag makapal yung basic lamina mo, since your capillaries are involved in metabolic exchange, of course, kung makapal siya because diabetic ka nga, there is decrease in metabolic exchange, particularly in your kidneys, kaya ka nagkakaroon ng diabetic nephropathy. Okay? Sa mata naman, diabetic retinopathy. Sa skeletal muscles naman, wala, nangangalay ka lang. Well, possible, peripheral neuropathy, and then your skin. Okay, kaya usually yung mga may diabetes, mahirap mag-heal yung sugat nila sa skin kasi nga lower na yung flow of blood doon. Kasi nga, ayan, makapal yung basal lamina nila. Okay, so basically kapag may kidney problem ka, ayan, pagkaroon ka ng chronic kidney disease, you will also go blind. And doon mo na nararamdaman yung pins and needles sensation. Okay, now let's go to your venules. Your venules naman, they are smaller than your veins. Okay, they just measure 10 nanometers or micrometers to 1 millimeter. Okay, so your venules, they are larger in diameter than capillaries, consisting of endothelium, also surrounded by your pericytes. Functions, since this is a subtype of your vein, nagko-collect na siya ng blood. From where? From your capillaries. Okay? So they respond to vasoactive agents like histamine and serotonin by alternating permeability. Kasi ang histamine mo, this is for vasodilation. Okay? Kaya nga nagtitake ka ng antihistamine pag may allergy ka para hindi nagmamanas. Ganun. And then your serotonin naman, this is for vasoconstriction. Ito yung unang napoproduce kapag meron kang sugat para magsara yung mga sugat mo. Okay? And then these venules, this is the site of exchange for materials between tissue, fluid, and blood. So this is a site of exit between WBCs from blood into the tissue. So this is your venule and then your arteriole. Ang clue namin as to why we are seeing a vein as compared sa artery is that ito. Isa sa trick ninyo ay actually number 1, para ma-identify mo na isang blood vessel ang nakikita mo sa isang tissue slide, tignan mo yung loob. Kung masyadong maraming red blood cells yan, most probably you are looking at a blood vessel. Okay? Kapag bilog yan, artery yan. Pero kapag pangit, wala siyang shape, vein yan. Okay? Ayan. So now let's go to your veins. Your veins, the blood under the flow of blood here is under very low pressure. It moves toward the heart by contraction of smooth muscle fibers, and they also have a valve, okay, which projects from the tunica intima to prevent blood backflow. Your small or medium veins, they are located close and parallel to the corresponding muscular arteries because yung mga muscular arteries na yon, as they contract, it will also help the veins propel the blood back to the heart. Okay? So kapag nagko-contract yung mga muscular arteries na katabi ng small and medium veins, papalayo sa heart, sa yung blood flow sa heart, tinutulungan naman nila yung veins para may squeeze siya para maibalik niya yung dugo niya papunta sa heart. Okay? So since this is a blood vessel, meron siyang intima, media, and adventitia. Ayan. So the function, collect blood. Ayan, again, this is your vein. Pangit yung tsura niya, artery, mas well-defined. And then you also have your large veins. So your large veins, these are your venous trunks. Kumbaga, they are also paired with your elastic arteries. Ano tong mga large veins na to? They are also located malapit sa heart. Sino sila? These are your superior and inferior vena cava. Okay? So the intima is well developed. They also have a tunica media with alternating layers of smooth muscle, and the adventitia is thicker than media in large veins and frequently contains longitudinal bundles of smooth muscle. So function to collect blood from your medium-sized veins. Yan. So this is your the wall of a large vein. So you can see here, this is the tunica intima, tunica media, and then your tunica adventitia. Ano ulit ang nakikita sa tunica adventitia? Your vasa vasorum. Ayan. This is your vasa vasorum and smooth muscle fibers which can also help in contraction of your veins para maibalik nga niya yung blood sa heart. And then this is, di ba, sabi ko kanina, yung flow of blood in the veins are dependent on the contraction of your arteries. At the same time, meron din siyang mga valves. Ito yung itsura ng valve histologically. Okay? So it is made up of dense irregular connective tissue, ayan, that protrudes out from your tunica interna and your tunica media. Okay? So ang gagawin ng valve na yan to prevent backflow. Ayan. These are folds of intima projecting into the veins. They are more numerous in the legs. Bakit? Sila yung farthest away eh. So, mas madaming valves yung mga nasa paa para mas umangat or para hindi mag-backflow yung blood back to the heart. Para mag-flow yung blood back to the heart. Okay? Ano yung correlation natin dyan? One clinical correlate is your chronic venous insufficiency. Anong nangyayari? This one occurs when your leg veins don't allow blood to flow back up to your heart. Ano yung mga possible pathophysiology niyan? Yung valves mo, okay? Nasisira yung valves na nasa legs. So instead na kapag nag-flow siya dyan, babalik siya, mag-close yung valve, hindi siya nag-close kasi nga, nag-weaken na siya. So ang nangyayari, since there is backflow, nagkakaroon ngayon ng backflow of blood, nag-accumulate siya dyan. Yan yung nakikita ninyong varicose veins. Okay? So, ito yung venous insufficiency mo. Una, spider veins lang siya, then nagiging varicose, and then nagsuswell na siya kasi wala nang pupuntahan yung mga veins mo ay yung mga blood mo na superficial So, naapektuhan na yung mga internal veins mo na nagkakaroon na ng edema. And then there will be skin changes because there is hyperaggregation of your cells there which causes now inflammation, and then since there is inflammation, nagsusugat ka na causing now your venous ulcers. And this can be tragic in the long run kasi pwede kang ma-amputate dahil dito. So ano yung management namin dito? Initially, we give compression stockings. Yung compression stockings para lang siyang masikip na medyas para matulungan yung flow of blood to the heart. Okay? So flavor your life in such a way that anyone who thinks he or she is biting or backbiting you will rather take smiles away unexpectedly and with surprises. So that's just a cookie cutter, okay, of our lecture. So let's now proceed to your lymphatic and immune system histology. Okay, so far na nakaka-keep up naman kayo. Although I admit this is quite overwhelming kasi nga two systems tayo, actually tatlo nga Lymphatic is different from your immune system. Ayan. So, ayan. Don't worry, I will give a copy naman of my lecture slides for your review. Okay, so now let's go to your lymphatic and immune system histology. So your lymphatic system, the function of your lymphatic system is to maintain fluid balance. Okay? When we say maintain fluid balance, they collect and return interstitial fluids, including the plasma proteins, back to the bloodstream. Kasi nga, yung blood vessels natin, they will give us fluid para sa mga organs. Pero in the process, there is a remnant, yung mga plasma fluids natin, nagko-collect doon sa tissues natin. So, ang magde-drain nun ay yung lymphatic system natin. Okay? Also, they function in fat absorption. Bakit? Because in your lymphatic system, there are our lymphatic vessels now that transports fat and other soluble vitamins in the form of chyle into the circulatory system. And then last function niya is to transport cells of the immune system. So nagiging conduit yung lymphatic system natin for the passageway of your different immune system, like yung pag-form ng mature T lymphocytes, B lymphocytes, mga ganun. And we will discuss them later. Okay. Ayan. So the components of your lymphatic system is number one, you have your lymph or the fluid from your interstitial spaces and your lymphatic vessels. You also have your lymphoid organs, which can be primary or secondary. Your primary lymphoid organs are your thymus and bone marrow because they allow maturation of your T cells and B cells. Your secondary lymphoid organs naman are just aggregates of immune cells, kaya sila tinawag na secondary, so they can be found in your tonsils, lymph nodes, and your spleen, as well as your mucosa-associated lymphoid tissue. And then, ayan, so since your lymph is comprised of your lymphatic vessels, of course, there is a correlation of your lymphoid system and your vascular system. So we have the lymphatic vascular system, which has a one-way valve for unidirectional flow, just like your veins. Okay, so the lymph, it is a clear, watery, slightly yellowish fluid that carries lipids and lipid-soluble materials absorbed from the gastrointestinal tract. And then the chyle, or chyle, it's a milky fluid containing emulsified fat and other products of digestion formed in the small intestine. So this is just the flow of lymphatic fluid from the right lymphatic duct, and then the right lymphatic duct drains the right side of your body. Ito lang siya, right upper. So from the neck, thorax, and upper limbs, ito lang siya. Ito yung dinadrain ng right lymphatic duct. Or, saan naman yung picture? Ito. The yellow one, this is drained by your right lymphatic duct. And then the green one is drained by your left lymphatic duct and your cisterna or your thoracic duct. Ayan. Lower half of your body. And then you have your cisterna chyli, which is a dilated sac in the inferior end of the thoracic duct. And then the right lymphatic duct and thoracic duct will converge and drain the subclavian vein. And then your subclavian vein, papunta na siya sa heart. Okay? So clinical correlation of your lymphatic system, you have your lymphedema. Ano yung lymphedema? So it is a localized type of edema or manas in Tagalog, which occurs when lymph nodes do not drain from the area of the body and can happen when surgical removal of cancerous lymph nodes. In between your lymph vessels kasi, there are lymph nodes, okay? So kapag surgically na-remove sila, sometimes there is lymphedema that can occur. A very good example of this is kapag nagkaroon ka ng mastectomy, kapag na-remove yung breast mo, usually yung mga patient natin na ganun, ayaw na nilang paggalaw yung right arm nila for venipuncture. Kasi once na nagkamali ka dyan in your venipuncture, hindi na, kapag nagkamali ka dyan, nag-sip out yung blood, sino ba yung magde-drain nun? The lymphatics, di ba? Since madaming natanggal na lymph nodes dun sa breast, possible na hindi na bumalik kasi yung lymph fluid na nag-accumulate sa tissues mo, mamamanas na yung right arm nila. Okay? Hindi na maibabalik. Kasi nga, kapag mastectomy, nagre-remove ka ng breast at the same time, nagre-remove ka ng lymph nodes at the same time, nadadama yung mga lymphatic vessels. Okay, so now let's go to your immune system. So your immune system, basically from the name itself, di ba? It is a defense or immunity. It talks about defense or immunity or versus infectious agents. Okay, so we have the concept of tolerance to or unresponsiveness to self-antigens, and it can either be central tolerance or peripheral tolerance. When you say central tolerance, the immature lymphocytes that recognize self-antigens in the central or your generative lymphoid organs like your thymus are killed by apoptosis. And kapag peripheral tolerance, mature lymphocytes that recognize self-antigens in the peripheral tissues become functionally inactive or anergic or are suppressed by regulatory T lymphocytes or die by apoptosis. Basically, ang central nasa primary lymphoid organs mo, yung peripheral naman, different parts of the body. So you have two types of immunity, okay? You have your innate and your adaptive. When you say innate system, natal, di ba? Natal since birth. So since birth, meron ka na nito. Okay, so let's go first to your innate immunity. Your innate immunity is considered to be non-specific. Bakit? Lahat ng foreign substances sa katawan mo, with or without exposure pa yan previously, gagalaw siya or gagana siya. Okay? So part of this innate immunity is, ayan, first line of present from birth, first line of defense. It requires no prior exposure to antigen. It requires no memory. Components of this one are your granulocytes and other leukocytes, your complement, and your interferon. So it's considered to be the first line because you have your physical barrier. Ano yung mga physical barrier ninyo? You can have your stomach. Diba? Sa stomach mo, you have your hydrochloric acid production doon, which is a very hostile environment for microorganisms, diba? Except for Helicobacter pylori. Another one is your skin, di ba? Your skin has three layers. You have your epidermis, dermis, and your subcutaneous layer. And then the epidermis itself, marami pa siyang layers, di ba? Stratum corneum, stratum lucidum, stratum spinosum, granulosum, and your stratum basale. So basically, yung skin natin is a protective layer which blocks the entry of your environmental microbes. Ano pa, yung mga mucosal linings natin, di ba? Kaya nga siya tinawag na lining because it serves as a cover. And then sa tears natin, it also gives us additional protection kasi sa tears natin may mga lysozymes dyan. And then yung ultimo pag-ubo natin, the cough reflex is basically a first line of defense against invading organisms. Kasi kapag inubo ka, that means yun yung mechanism of body or your body para ilabas yung invading organism. Okay, and then your second line naman, phagocytes, your neutrophils, monocytes, and your macrophages, as well as your antimicrobial proteins. So one thing to take note here in your innate immunity is your complement, okay? Complement, yung mga cropek, complementary foods naman yan, okay? Yung mga complement natin, it is a system of proteins in the blood plasma, mucus, and macrophages that react with bacterial surface components to aid removal of your bacteria. Kaya not all of the time, meron tayong infection kasi nga meron tayong complement system na tinatawag. Because before pa na pwedeng mag-elicit ng infective or infectious substances yung bacteria, pwede na silang ma-deactivate. By how? By your complement, okay? So ito yung complement pathway natin. We have three pathways. You have your classical pathway, your lectin pathway, and your alternative pathway. But ultimately, they will converge into, or ito siya, or your classical is your immunocomplexes, your lectin pathway, which is triggered by your mannose rich surfaces na nasa surface ng bacteria, and then your alternative pathway, ano naman yung mga yan? Yung mga lipopolysaccharide ng bacteria, mga apoptotic cells, and your necrotic cells. So basically, no, kapag nagkaroon ng antigen-antibody reaction, natitrigger ngayon yung three pathways natin. Depende if it is the classical, lectin, or alternative. Ang goal nila, ayan, is to form now your mga C3 convertase and your C5 convertase. Yung mga complement proteins natin, your complement 4 and complement 2, they will be activated. Paano sila ma-activate? They will be cleaved into two. So as you can see in the picture, naging C4b tsaka C4a. Okay? Yung C4b, nag-join siya with your C2b. So naging C4b2b. Okay? So nag-combine sila. And then yung dalawang natanggal na sa C4a and C2a, those are termed as your anaphylotoxins. Okay? Ano yung kaya nga letter A, anaphylotoxins. Ano yung importance ng mga anaphylotoxins? Anaphylotoxin serves as a signaling substances. Paano sila nagsisignal? They will recruit other cells doon sa area kung saan nandun yung microorganisms. Ano pa? Since they are anaphylotoxins, anaphylaxis, di ba? They also induce allergic response. And kapag may allergic response ka, di ba, nagvavasodilate, di ba? Para maka-diapedesis yung mga cells mo going now to your focus or localized area kung nasan yung infection. Okay, so nag-combine si C4b, C2b, ayan, they will cleave now your C3, okay? So C3 convertase now, since convertase is an enzyme, ang ang components ng C3 convertase mo ay si C4b, 2b. Okay, so i-cleave niya ngayon si C3 into C3b and C3a. Again, si C3a, since meron siyang A, isa siyang anaphylotoxins. Magre-recruit ulit yan ng mga other substances para sa inflammation. Again, si C3b ngayon, magma-merge siya with your C4b, 2b, and then si C4b, 2b, 3b, ito na ngayon yung tinatawag nating C5 convertase. Ano si C5 convertase? Siya ang mag-activate kay C5 para ma-initiate ngayon yung membrane attack complex natin. Ang membrane attack complex natin is your C5b, 6, 7, 8, 9. Okay? Your membrane attack complex kapag na-form yan, C5b, 6, 7, 8, 9, membrane attack complex, gagawa yan ngayon ng butas. Okay? Bubutasan niya yung microbial cell para mag-lyse siya or pumutok siya. Okay? So, ganun. So, that is your classical. Paano naman si lectin? Ganun din. Pero ang nag-trigger lang ng initiation niya ay yung mga manus doon sa bacterial cell wall. Sa alternative pathway naman, ang C3 convertase natin dito ay si C3BBBB. May capital B doon kasi ang nag-cleave sa kanya ay si factor B and factor D. Ang may main contribution diyan ay si factor B, kaya siya na-incorporate with your C3b. Okay? So ang C3 convertase mo sa alternative pathway ay C3b na maliit, malaki na B, and then maliit na B. And then magko-combine with your C3b, so magiging C3BBB3B. O, di ba? Pwede nyo siyang gawing password ng Facebook ninyo. Mahirap yung hulaan. Diba? C3BBB, C5 convertase, ultimately cleaving now your C5 para again, ano yung ma-produce mo? C5b, and then magko-combine yung 5, 6, 7, 8, 9 para magkaroon ka ngayon ng membrane attack complex. Again, this is just another picture showing now your membrane attack complex. Formation of your C3b via your C3 convertase, your C4b, C2a, or C4b2a in your classical pathway. Sa alternative naman is your C3BBB. Ayan, ultimately giving you your, kapag sa classical pathway, C4B2A3B, and then in your alternative is your C3BBB3B. And then, si C5B magko-combine with C6, C7, C8, C9, and then magkakaroon na ngayon ng membrane attack complex. Mabubutas na yung bacterial cell, tapos mamamatay na siya. Ano yung clinical implications ng membrane attack complex natin? Okay, so lahat ng yan, yung mga complement factors natin na yan, C4A, C3A, ganyan. Kapag nawala sila, of course, meron tayong defect in your complement pathway, di ba? So kapag may defect ka, mas prone ka to infection. So kapag C3 deficient ka, ano yung pwede mong maging sakit? Recurrent pyogenic infection. Okay? Kapag deficient ka sa C1Q, C1, kakaroon ka ng SLE, kapag deficient ka sa properdin, yung properdin ay nire-release kasi ng spleen para malabanan yung mga encapsulated organism. So later on, kapag mawalan ka ng spleen, tapos mawalan ka ng properdin, mas prone ka to recurrent encapsulated bacterial infections like your gonorrhea. And then, deficiency in factor H, ayan, magkakaroon ka ng hemolytic uremic syndrome, glomerulonephritis, C1 inhibitor deficiency. Ang C1 inhibitor deficiency, magkakaroon ka ng angioedema. Bakit? Kasi, kahit walang trigger, na-activate na ngayon yung complement cascade mo. And kapag na-activate yung complement cascade mo, nagkakaroon kayo ng mga anaphylotoxins, di ba? Sila yung nagmimediate ng anaphylaxis. So, nagkakaroon ngayon ng edema. And then, you have your deficiency of CD59, which causes now your hemolysis. And then also part of your immune system is your interferons. Your interferons are paracrine factors from your leukocytes and virus-infected cells that signal your natural killer cells to kill such cells and adjacent cells to resist viral infection. So ano yung mga interferons natin? Ito siya. For example, may virus na pumasok or na nakita ng isang natural killer cell. Okay? Sila yung magsisignal, kumbaga. Sila yung taga-signal sa mga neighboring uninfected cells para mag-destroy ng mga viral proteins. Okay? Sila yung kumbaga taga-relay ng information na uy, merong invading substances dito. Kailangan nating patayin. Gano'n. So yun yung function ng mga interferons natin. So these are peptides and glycoproteins with low molecular Sorry, nawala ako. Nakashare pa ba yung screen ko? Hindi.
Hindi nga po, Doc.
Saan ako nag-stop? Dun sa interferons?
Yes po, yung may table sa gilid po.
Okay. Nakikita nyo na?
Yes po, Doc.
Actually, I'm so sorry guys. This slide should be... Ang title nito is cytokines dapat hindi interferons. I'll just change it before sending them to you. So your cytokines naman, they are peptides and glycoproteins with low molecular weight and they coordinate with your cells for activities with paracrine mode of action. Okay? So ano yung mga examples natin ng cytokines? You have your mga to. Okay? So your cytokines can be in the form of granulocyte, monocyte, colony stimulating factors or monocyte colony stimulating factors, mga ganun. So ano yung mga function niyan? They mainly functions in your cell differentiation. Yung mga blood groups or blood cells natin na nasa bone marrow, kapag naapektuhan sila ng mga cytokines, they will be induced to their maturation. Okay? So another types of your cytokines are your interleukins, like your interleukin 12 for the stimulation of your NK cells, interleukin 5 for your eosinophil proliferation, interleukin 10, interleukin 8, ganyan. Okay? So in the concept of immune system, hindi makakatakas tong concept na to, okay? The antigen and the antibodies. Okay, so when you say antigen, these are foreign substances. Hindi siya kilala ng katawan. When you say antibodies, these are substances or immunoglobulins na pinoproduce ng katawan natin para labanan yung antigen. Okay? Sige, antigens are any foreign substances that can elicit an immune response in the host. Okay, so you must remember that not all antigens are foreign. Kasi you can have autoimmune diseases na yung mga antigens mo naman sarili mo. Okay, so those are your self-antigens. And then you have an epitope or antigenic determinant, and then these are small domains or part of the antigen that reacts with antibodies or cells of the immune system. So these are specific for a particular antibody. Basically, yung antigen and two variable regions, this one. So two variable regions, you have your antigen binding site or your Fab, and then your fragment crystallizable or yung kakapit naman sa mga cells mo. Okay? So you have two variable regions. You have your light and heavy chains where the antigen binds to the antibody. Ito siya. This is your light chain and then this is your heavy chain. Kasi nga mas malaki siya. The FC or the fragment crystallizable is made up of isolated carboxy terminal of the heavy chains, and they bind to the antibody to immune complex and binds to the major histocompatibility to react. Okay, so this is now the major determinant bakit tayo sometimes kapag pumalya kasi ang major histocompatibility complex, diyan nagsa-start yung autoimmune diseases. Ayun. This is also the basis of your transplant. Ayan, so again, this is the picture of your antibody. You have your antigen binding sites, and then your fragment crystallizable, and then this is your antigen possessing now your epitope. Okay, so ito yung epitope mo. Ayan. So in your antibodies, you have 5 DD and your IgE. The percentage of them in your serum is that pinakamarami sa IgG, followed by your IgA, and then IgM, IgD, and then your IgE. Okay? So saan mo sila pwedeng makita? Yung IgG mo, it is present in your fetal circulation in your pregnant women. Actually, yan din yung nakikita natin kapag meron tayong chronic infections. Okay? IgG for chronic infections or recurrent infections. IgM naman kapag they are the first antibodies to be produced in an initial immune response, which activates now your complement. Okay? Kapag IgM naman, it's a large multimeric kasi yan. 5 kasi yung kamay niyan. So, malaki yan. And then, it will now, this is the antibody that is present sa initial infection. Okay? Kapag IgA naman, surfaces of mucosa. So, yan yung IgG, immunoglobulin na nasa mata natin, sa tears, sa saliva. And then IgD, it's the immunoglobulin na nasa receptor sa mga B cells. And then for IgE naman, they participate in your allergy. Okay? Kaya siya tinawag na IgE, allergy. And destruction of your parasitic worms. So this is a graph showing you the rise and fall of your antibodies. So if an initial infection, kumbaga dengue, ang dengue, kapag na-dengue ka, ang unang magra-rise dyan ay si IgM. Okay? And then, mga after 2 days, magde-decline yan, and then, mawawala. Kapag nawala sa IgM, that can be a marker of gumagaling ka na, okay? Or pagaling ka na. Kapag sa IgG naman, usually, nag-a-appear yan kapag pagaling ka na talaga, okay? And then, pwede siyang ma-trigger ng memory. So, kung the second time around, na-infect ka with the same infecting substance, hindi mo na need ng masyadong mahabang exposure, kumbaga. Kasi nandyan na si IgG na nakaantabay. Okay? So ito usually yung principle behind your vaccines. Kasi kapag binabaksinan ka ng isang doktor, nagpo-produce ka ngayon ng sarili mong immunoglobulins, initially IgM and then IgG. Para kapag na-infect ka ng totoong, for example, chickenpox, nandyan na yung mga IgG mo na nakaantabay. Okay? The next one, you have your cells of the immune system. Okay? So the cells of your immune system are distributed throughout the body. Pwede mo silang makita in your lymph, blood, epithelia, connective tissues. They are considered to be motile. Gumagalaw sila. They participate in your phagocytosis. Well, yung iba. Okay, and then they detect foreign substances and organisms and antigens that could trigger an immune response. Okay, so you have three different types of your immune cells. You have your T cells, B cells, and your natural killer cells. And you also have your antigen-presenting cells, which can be made up of your macrophages, dendritic cells, and your Langerhans cells. So this is a picture of your lymphocyte. It can either be B cell or a T cell. Histologically, you cannot differentiate them kasi eh. And then this is your natural killer cell. And then this is your dendritic cell and your macrophage. So the cells of your immune system, they can either be lymphocytes, which are B cells, T cells, and your NK cells. Your T cells can be subdivided into three. You have your CD4 or your helper T cells, CD8 or your cytotoxic T cells, and your regulatory T cells. Your helper T cells, it activates now your B cells and your T cells. And then your cytotoxic, for your cytotoxic, it kills your cells, and then your regulatory cells to suppress now the immune system. This is for self-tolerance and yung mga autoimmune diseases natin. And then your antigen-presenting cells, you have your B cells, dendritic cells, and your macrophages. So, ayan. So your B lymphocytes, the origin of this, since it is B lymphocyte, it's in your bone marrow, okay? So they live in the bone marrow completely functional. So 20 to 30% of the circulating lymphocytes can form plasma cells or antibodies or memory B cells. So dalawa yung pwedeng fate ni B cells mo. Okay, so upon exposure to an antigen, it will proliferate and become a plasma cell, this one, or a memory B cell. Okay, yung memory B cell mo, para din siyang IgG, kumbaga, pero cell lang siya. Si memory B cell mo na yan, nakaantabay na, just in case, nandyan ulit yung invading organism, nandyan na siya, no need to be reactivated, kumbaga. Si plasma cell mo naman, this is a cell that produces your antibodies. Okay, primary fate of B cells, So, ayan. So, yung main purpose ng plasma cell mo is to synthesize now your immunoglobulins. So, one thing to take note of your plasma cell is that para siyang mas malaking lymphocyte pero more bluish, and then mas defined yung nucleus, yung nucleus niya because of the perinuclear halo. So, makikita nyo dito, meron siyang clearing. Okay? So plasma cell mo meron siyang clearing dito sa side ng nucleus. So this is your plasma cell. Again, anong function ni plasma cell? To produce now your antibodies. Okay, so you also have your T lymphocytes which originates from your bone marrow pa rin. Okay? They originate in your bone marrow pero they mature in your thymus. Kaya sila tinawag na T lymphocytes. Okay? Common mistake kasi yon, where do T lymphocytes originate? Usually sinasagot natin dyan thymus kasi nga T. Pero they originate still in the bone marrow, nagmamature lang sila sa thymus, wherein they will get their cluster of differentiation. Kapag 4, magiging T helper. Kapag cluster of differentiation 8 or CD8, nagiging cytotoxic. Okay, so they are majority of your lymphocytes. Your T lymphocytes only recognize epitopes that form complexes with special proteins called your membrane or major histocompatibility complex. So again, kapag meron kang antigen, nakikita yan ni antigen-presenting cell. Si antigen-presenting cell, gagawan niya ngayon yan ng, ipepresent niya sa major histocompatibility complex 2 natin, which will be detected by your T helper cells. Okay? So kung na-detect ni T helper yung major histocompatibility complex, mag-proliferate yan ngayon to T helper, and your killer T cells or your cytotoxic T cells, and your T helper cells can further develop into a macrophage, and then your T helper can activate your your T helper cells can activate macrophages, and your T helper cells can activate now your B cells, becoming plasma cells and producing now your platelets, antibodies. Your T helper cells or your CD4 T cells, they produce cytokines, yung nasa primary immune system natin kanina, to promote B cells, and they activate macrophages to become phagocytic and also activate your cytotoxic T lymphocytes. So a clinical correlation for your T helper, saan nyo nakikita si CD4? Anong sakit? Usually sa HIV, di ba? So in your HIV, a decreased CD4 count is actually a bad sign, okay? It will make you more susceptible to opportunistic infections, and this is usually seen kapag nasa terminal stage ka na ng HIV infection, which is your AIDS. Okay, so kapag nag-decrease ka ng 200 microliter of your CD4 count, kapag less than 200 microliters ka na lang doon, you can have opportunistic infections like kapag sa pneumonia, your pneumocystis jirovecii, nagkakaroon ka rin ng meningoencephalitis, toxoplasmosis, ultimo candida, na-infect ka na. Okay, so this one, cytotoxic T cells naman or CD8, it directly act against foreign cells or virus-infected cells. So the cell they attach to the cells and release lymphotoxins and perforins, which can cause cell lysis, and after attachment, they trigger mechanism that induces apoptosis. So ano yung mga na-produce doon? Yung mga granzymes, mga lymphotoxins para sirain yung mismong cells or virus-infected cells or mga cancer cells. So regulatory cells like your CD4 and CD25, they maintain unresponsiveness to self-antigens and suppresses excessive immune response, which plays a role in allowing immune tolerance para hindi ka magkaroon ng autoimmune diseases. So these are the relative percentages of your T lymphocytes and B lymphocytes. Sa thymus mo, walang B lymphocytes doon. In your bone marrow, majority of them is your B lymphocytes. In your spleen, mas majority ang nandyan ay B lymphocytes. Lymph nodes, T lymphocytes, and in your blood, mas madaming lymphocytes kesa B lymphocytes. And then you also have your natural killer cells. Your natural killer cells, they make up 10 to 20% of your circulating lymphocytes. They have no surface markers, and then they primarily attack virus-infected cells and transplanted cells and cancer cells without previous stimulation. Kumbaga sila yung pinaka-astig sa mga immune system cells natin kasi they do not need any activation. Kumbaga kapag nakita niya, sasapakin na niya kaagad. Ganun. Okay, so this is the activation of your NK cell. The Fc region of the antibody binds to the NK cell, triggering its release of your perforins, mga granzymes. Ayan. So nasira na kaagad yung virus-infected cell mo. So ganyan siya kastig. Again, and then you also have your antigen-presenting cells. So your antigen-presenting cells naman, they can be your macrophages, dendritic cells, Langerhans cells, and they perform now the three functions, which are your 3Ps, which is your phagocytose, process, and present antigens. Because these antigen-presenting cells, kapag nakakita sila ng antigen, they will now present them to saan? Sa mga natural killer cells, sa mga B lymphocytes, T lymphocytes, okay? So by presenting these antigens, they bring now the foreign body to your lymphoid organs. Yun yung presenting part. And then they will be processed by how? They will be phagocytized and then inactivated. So just an overview of your major histocompatibility complex, no? Because this topic is quite complex. So basically, these are just a cluster of genes located in the short arm of your chromosome 6 or your CPQ. So these proteins were first recognized in their roles of the immune system, and they basically perform in your graft and tissue uh, rejection. So itong major histocompatibility complex mo, sige, dito na lang tayo. So upon the interaction of an antigen-presenting cell, so antigen associates with the major histocompatibility complex. So sa major histocompatibility complex, kukunin niya ngayon si antigen, okay? And then magiging receptor siya. Ipe-present niya ngayon doon sa T-cell receptor. Okay? So kung T-cell receptor, napansin niya, hindi sa akin to. So once na napansin ni cytotoxic T-cell na hindi sa kanya yan, mangyayari, papatayin na nila ngayon si infected cell. Okay? Dito naman sa T helper cell, microbe, kinuha niya yung mga antigens ng microbe, and then si MHC class 2, pepresent niya ulit sa T cell receptor, and then si T helper, tutulungan niya ngayon yung mga other cells para patayin naman ito. Okay? So your major histocompatibility complex, you have 3 classes of genes. Okay? So class 1, they are present in it's comprised of your HLA or your human leukocytic antigen A, B, and C. Yan yung majority of your class 1. So for class 2, nandiyan si HLA-D, which can either be which is further subdivided into DR, DQ, and your DP, okay? And then so in your MHC, since sinasabi ko nga kanina, they usually yung importance nila lies in your transplant success. The immune response is the primary determinant of graft viability. So it is dependent on the human leukocyte antigen typing for graft compatibility, and it is important in renal, lung, cardiac, and pancreatic matching. So you need to be matched sa 6 na antigen. Nasaan yung 6 na antigen mo na yan? So you have your HLA-A, 1, HLA-B, so 2, HLA-C, which is your pangatlong antigen, and then your HLA-DP, DQ, and your DR. So 6 yan. Dapat ma-match ka sa 6 na to para maging successful yung transplant mo. Okay? So positive cross-match shows that preformed antibodies are present, leading to hyperacute rejection. Ibig sabihin, kung nagkaroon ka ng antibodies directed towards these HLAs, hindi pwede yung transplant sa'yo. Okay? So the cluster of this HLA, which is located in your chromosome 6, will now determine whether the graft will be accepted or rejected. So medical application, ayan, we have your different types of grafting. Kapag yung sarili mo, yung dinonatan mo, for example, yung skin mo, or nagka-burn ka, tapos transfer yung skin mo sa puwet, sa mukha mo, that is your autograft, okay? So self. Kapag nanggaling naman yung transplant sa'yo sa identical twin mo, that is known as your isograft. And then kapag same species, kapag different tao, that is your allograft. And then kapag galing sa baboy, di ba meron ng ngayon? Successful na heart transplant na galing sa pig. Pero namatay din siya kalaunan. Nag-survive lang yata siya for 2 months or 2 years. So, that's what you call your xenograft. Okay? So one thing to consider when grafting or transplant is that you need to have immunosuppressants. Immunosuppressants, ibig sabihin, sinusuppress mo yung immune system mo para yung body mo kunin or tanggapin yung nabigay sa'yo na organ. Okay? So you have 2 immunosuppressants. You can have induction drugs, and then your maintenance drugs. Yung maintenance drugs mo, actually chronic na to for life, ite-take mo siya every now and then. Can be in the form of steroids, mga ganun. Pero ang caveat nito, since naka-immunosuppressant ka para tanggapin yung graft na yon, prone ka naman to, since na-suppress yung immune system mo, prone ka to infections. May bago kang ang puso pero pabalik-balik naman yung sakit mo, di ba? Yun yung caveat nun, di ba? So, now let's go to your organs of the immune system. So the general features of your immune system is that they has a rich supply of your lymphocytes. They can either be encapsulated or non-encapsulated, and they have a very little cytoplasm. So let's go to your first organ. You have your lymph nodes. Your lymph nodes, they are kidney bean. They are kidney bean shaped. They are encapsulated. So as you can see here, so as you can see here, ayan, meron siyang capsule and then it is convex. It has a convex surface, paloob, and a concave depression. Ito, convex surface, concave depression, which is your hilum is, can be found in your, since it is a hilum, dyan papasok yung arteries, nerves, and veins. And then the connective tissue surrounding the capsule will have a trabeculae that will send it into the interior. Itong mga papaloob na yan, ito yung trabeculae na tinatawag natin. So the function of your lymph node, it acts as a filter. Diba? Kaya kapag nagkakasakit ka, lumalaki yung mga kulan mo na infection. So clinical importance, enlargement secondary to infection, and metastasis in your malignant tumor cells. And it can be used in staging cancer. In the medical field, or in surgery actually, surgical oncology, you have what you call the TNM staging. T for tumor size, N for nodes, and then M for metastasis. So yung letter N doon, TNM, the node there, kapag meron na kasing node involvement, yung cancer mo or yung tumor mo, ibig sabihin nun, possible na nasa stage 3 ka na or stage 4. Okay? Or stage 2 na malala. Ganun. Okay, so structural organization. You have your afferent lymph vessel. It brings lymph toward the lymph node, and then your efferent lymph vessel, which convey lymph away from the node. Then you have your lymphoid nodules, which is comprised of your capsule. So ito yung afferent and efferent natin. Afferent, ibig sabihin papasok kasi nga letter A mas nauna sa E. So A, afferent, papasok sa lymph node, and then efferent, palabas naman sa lymph node. So the supporting structures, you have your capsule surrounding the lymph node. You have your subcapsular sinuses, your trabeculae, which is made up of dense connective tissue, and your reticular tissue, which supports the network of organs and forms reticular cells or fibers. So again, this is your lymph node. So the flow of lymph fluid, pagkatapos na niyang nangolekta sa mga different organs, kung saan dumaan yung blood mo, ay papasok siya ngayon sa lymph node para malinisan, kasi nga ma-filter, and then lalabas ngayon siya ulit dyan. Papunta na ngayon sa lymphatic drainage. Again, this is your capsule, this is your hilum, and then yung mga paloob ni structures, those are your trabeculae. Then you have two surfaces or structures or histological structures in your lymph node. Okay, you have your cortex, which is this one. Mga cortex mo, ayan, mga nasa loob. Yung mga aggregates dyan. Ayan. So your cortex, it is located outer, superficial, or the nodular cortex. It is made of mainly of your lymphoid nodules, which is mostly your B lymphocytes. Your lymphoid nodules are found only in the cortex. They may or may not have germinal centers. Yun yung say germinal centers, dyan nag-proliferate yung mga B cells. Because kapag wala silang germinal center, it is pale when active. Okay? And then kapag yung mga T cells mo naman, you can also see here T cells, antigen presenting cells, and your macrophages. Ayan. So since it is a germinal center, ayan, may mga nagpo-proliferate dyan. It is usually pale. And then ito yung cortical zone mo. And then this is your marginal sinuses. You also have your paracortex. Your paracortex just outside your cortex. Ayan, yung mga nasa sa gilid nila. This doesn't have a lymphoid nodule. Ang majority of cells here are your T lymphocytes and is high endothelial venules are present. And then the medulla, the medullary cords naman, kapag nag-dive into deeper ka dito, sa gitna na mismo ng lymph node mo, your medullary cords, they contain B lymphocytes and some plasma cells, and your medullary sinuses, they separate the medullary cords, which contains now your lymphocytes, and your macrophages. Ito siya. Kumbaga, papaloob ka dyan, ito yung trabeculae mo, and then dito yung mga cortex mo, paracortical zone, and then ultimately your medulla. So the left half, dito, sa medyo reddish part, okay? So the major regions and structural components of your lymph node are seen here, okay? So the lymph fluid enters via the afferent lymphatics, ayan. So, ayan, papasok siya dito, and then passes down to your unlined sinuses, ayan, dito, and then ultimately, bababa siya dito sa afferent lymph nodes mo. Lalabas siya sa hilum. Okay? In your right side naman, this depicts now the flow of blood. Sa left side, this is the flow of lymph fluid, again, afferent to efferent. And then dito sa right side, this is the blood circulation. So you can see here that there is a small artery and vein that enters both in your hilum. Okay? So parehas si vein and artery, papasok sila dyan, and then it will give now the blood supply of the entire lymph node. So another clinical correlate for your lymph node is that you can see lymphomas. Ano yung mga lymphomas? So these are localized lymphocyte malignancies that often form solid tumors affecting mainly your lymph nodes. Diba, majority of our lymph nodes can be seen sa neck area, sa armpits, diba? So kapag may bukol dyan, usually dito, a good differential for those are your lymphomas, aside from goiter or thyroid pathology. Ganon. So your lymphomas. So mostly your lymphomas can be the Hodgkin types or Hodgkin type or your Hodgkin disease. Okay? So a type of lymphoma distinguished by the presence of the Reed-Sternberg cell. Okay? So kapag nakakita ka kapag binayopsi mo tong bukol na to, nakakita ka ng Reed-Sternberg cell, ito, your Reed-Sternberg is a histopathological marker of your lymphoma, okay? So it's basically a bilobe nucleus with prominent nucleoli that resembles an owl. Okay, so kung titignan mo, kung mag-i-imagine ka, para siyang mata ng kwago, di ba? Or owl. So in contrast with the non-Hodgkin type, the Hodgkin lymphoma responds well to radiation and chemotherapy. Okay, so kapag hindi ka naman nakakita ng Reed-Sternberg cell, ibig sabihin, that can be a type of the non-Hodgkin type of lymphoma, which is mas mahirap gamutin kasi nga hindi sila responsive to radiation and chemotherapy. Usually, ang ginagawa dyan is surgical removal. Another one, medical application ng mga lymph nodes mo is your metastatic cancer cells. Bakit? Kasi nga, when you say metastasis, yung cancer mo, kumalat na. Paano sila nakakakalat? Via your lymphatic vessels. Okay, from one lymph node to another lymph node, ganun sila kumakalat. Kaya nga, doon sa TNM staging natin, kapag yung lymph node, may involvement na yung cancer doon, kumalat na yung cancer doon sa lymph node na yon, it can be a sign na progressive na yung cancer or nasa higher stages na siya. Okay, so your metastatic cancer cells detach from the primary tumor and can enter the lymphatics and are carried by nearby lymph nodes. So the first lymph node na naaapektuhan ng cancer cells are your sentinel lymph node. Okay, the first one downstream of the region with the tumor. And then during cancer surgery, the lymph nodes in the lymphatics draining the tumor area are examined by pathologists for their presence. So ayun, kapag may tinatanggal na organ, isa sa mga tinitignan din ng pathologist talaga ay binibilang niya yung lymph nodes na nandun, tapos ine-examine niya yan isa-isa. Kasi nga kapag may cancer cells na yon, as I've said, can be a sign na progressive na yung cancer. Okay, so another organ of your immune system is your thymus. So your thymus is a bilobe structure within the mediastinum. Dito siya sa may bandang heart. So the embryo's third part of the pharyngeal pouch, which is the endoderm, it is most active and prominent before puberty. And then as we grow older, it will regress. So it will involute with less activity. It is the primary or central lymphoid organ in which T cells are produced. Okay, so for the maturation process, dito nagproliferate, and then the rearrangement of your T cell receptor genes and the acquisition of surface receptors, accessory molecules to your T cells. Dito kumbaga nabibinyagan yung T cells mo as to magiging CD4 ba sila or CD8. Okay? So at this stage, T cells with the ability to react with self-antigen tolerance. So kung yung T cells mo pumapatay ng mga self-antigens, pinapatay na sila ng thymus. Okay? So kapag nagmamature naman sila, nalaktawan nila yung screening process, they go now to your secondary lymphoid organs for the quest of antigens. Doon na sila magtitingin or magsusurveillance ng mga invading organisms. So anatomic-wise, this is your thymus. So as you can see here, mas malaki yung thymus ng bata. And then, yung thymus ng adult, mas maliit na lang siya. So your thymus also has a cortex and then the medulla, gaya dun sa lymph nodes ninyo, okay? So the cortex, as you can see here, is in the periphery. It is darkly staining due to richer small lymphocytes than the medulla. The medulla in here, it's your central light zone. So the medulla, it has a fewer lymphocytes. Ang majority nito ay yung mga reticular cells. Ito, itong mga naka-arrow. So ang isa sa mga palatandaan mo kapag nasa medulla ka are your letter H. Ano yung mga letter H na yan? These are your Hassal's corpuscles. Okay? So kamukha nila yung mga Pacinian corpuscles sa skin. Sa cortex naman, it is dark staining because of your lymphocytes, and then they also have epithelial reticular cells for support. So one medical importance of your thymus is that your DiGeorge syndrome. Okay, in your DiGeorge syndrome, there is failure of the development of the third and fourth pharyngeal pouches. Diba sabi nga natin, saan galing si thymus? Doon sa third pharyngeal pouch nung bata. So the absence of your parathyroid gland thymus, so it's the loss of, since sa thymus nagmamature yung mga T cells mo, and in the DiGeorge syndrome or thymic aplasia, wala kang thymus. So, mawawalan ka ng T cell mediated immunity. Anong consequence niyan? Recurrent fungal and viral infection. Okay? So, ano pa yung mga nakikita mo dito? You can have a short stature and learning difficulties. So as you can see in the picture, dito sa picture ng isang patient na may DiGeorge syndrome, ito yung mga characteristic facial features niya. Meron siyang underdeveloped jaw, meron siyang smooth philtrum, wala siyang curvature dito sa pagitan ng ilong tsaka bunganga natin. Meron siyang low nasal bridge, small head, which attributes to the learning difficulties, the epicanthal folds, the flat mid-face. And then we also have the catch-22 na mnemonic. Ano yung catch-22? These are, kapag meron kasing DiGeorge syndrome ang isang tao, if you investigate further, makikita mo meron din siyang other diseases aside from thymic aplasia, like cardiac abnormalities, especially tetralogy fallow. You can have abnormal facies, like ito, nakikita mo sa kanya. You can have cleft palate. or bingot. And then hypocalcemia due to hypoplasia and lack of parathyroids. And then it is mainly due to the deletion of the short arm in chromosome or long arm of chromosome 22 in your band 11. So yan yung mnemonic, catch 22 in your DiGeorge syndrome. And then next we have your red bone marrow. So the red bone marrow, ang function niya, it is soft, loosely organized, highly vascular material separated from the osseous tissue and the ostium. So basically this functions for hematopoiesis and the source of lymphocytes. So basically these are, as the cells mature, they will be pushed away through the reticular and endothelial cells to enter the sinusoids and flow away into the bloodstream. Okay, so ito lang siya. And then you also have your mucosa-associated lymphoid tissue. Your mucosa-associated lymphoid tissue it's a collective name given to your lymphoid tissue in your GIT and respiratory tract. They are just aggregates of lymphoid nodules. Kung naalala nyo kanina, yung cortex ng lymph nodes, tsaka yung cortex ng thymus, ganun lang siya, okay? Parang cortex lang siya na napadpad sa mga sa intestinal tract and in your respiratory tract. Yun yung mucosa-associated lymphoid tissue natin. So in the ileum, you can have your Peyer's patches. Okay, so sa Peyer's patches mo, meron kang mga M cells which are dome-shaped, covering the Peyer's patches into the luminal antigens for presentation of your T lymphocytes. So nandito sila. So as you can see here, this is your Peyer's patches or your mucosa-associated lymphoid tissue in your ileum. Kaya kapag nakakain ka ng something that can upset your stomach, ayan, ito yung first defense mo against gastroenteritis kasi nagpo-produce ka na ng mga antibodies and other immune cells para labanan yung organisms. And then you also have your bronchos-associated lymphoid tissue located naman to sa lungs. Okay, para hindi ka magkaroon ng pulmonary infection basta-basta. So as you can see, this is an aggregate of lymphoid or lymphocytes. And then you also have your tonsils. Your tonsils are irregular masses of lymphoid tissue in the mucosa of your oral cavity. So kapag tinitignan mo yung pasyente, pinabuka mo yung bunganga niya, yung dalawang malaking structure doon sa baba ng ngala-ngala, yun yung tonsils mo. Okay, so it can either be your so this is the first lymphoid organ na encounter ng antigens entering the mouth and nose. So palatine, pharyngeal, and your lingual tonsil. So it's considered to be an organ. So ito siya. So this is your pharyngeal tonsil, this is your palatine tonsil, and your lingual tonsil. So we have this concept of the Waldeyer's ring, okay? So the Waldeyer's ring, an uninterrupted circle of protective lymphoid tissue at the upper ends of the respiratory and alimentary tracts. So as you can see here, ito yung mga tonsils mo. Ayan. Sila yung parang pinakaunang kakapture ng foreign body or antigen that can possibly infect you. So ito yung itsura ni palatine tonsil. It is covered by stratified squamous epithelium. It is partially encapsulated kasi nga kapag tinitignan mo siya dyan, nakikita mo na siya, yun yung capsule niya. Pero connected siya internally, wala siyang capsule. Okay? So yung nakikita mo, this is the capsule, and then yung connection niya doon sa pharynx mo, unencapsulated, which is nagdediretso siya as a connective tissue. You have your lingual tonsil. Ayan, it lacks a distinct capsule. And then, your pharyngeal tonsil, ano naman ang meron kay lingual tonsil is your ciliated pseudostratified columnar epithelium as compared kay lingual tonsil natin and your palatine tonsil na stratified squamous. Bakit? Because it is now the beginning of or part siya ng respiratory system natin. Kaya siya ciliated pseudostratified. And one thing to take note in your lingual tonsil is that it has invaginated with shallow infoldings but lacks crypts. Okay, so one medical application nito ay yung very, very common na sakit natin, which is your tonsillitis. Okay? So it is more common in children than in adults because as we also grow older, yung mga children kasi malaking malaki talaga yung tonsils nila. Kaya kapag nagpapacheck up yung mga bata sa akin, kahit hindi ako gumamit ng tongue depressor, nakikita ko na talaga kung magaba yung tonsils nila or hindi. And then for adults, there is progressive atrophy or nag-involute din sila. Pero not totally, okay? Nandyan pa rin, kaso lumiliit nga lang sila. Ayan, so this can be your tonsillitis. It can be, this is the normal, and then kapag sumisilip na or kapag nagkikiss na sila, yan yung grade 4 tonsils na natin ang sinasabi. Ayan. So kapag paulit-ulit na na-infect yung tonsils mo, pakakain mo ng mga maruruming bagay or mga anything that is highly infectious, ayan, kakaroon siya ng exudates, then ultimately, nagkakaroon ng stones. And then possible, masubject ka to tonsillectomy. And then you have another organ, which is your spleen. Your spleen is considered to be the largest lymphatic organ. It is encapsulated. It is known to be the graveyard of your red blood cells, which last for, ano yung lifespan ng red blood cells natin? 120 days, okay? So it has splenic ligaments, which are avascular, except for the gastrosplenic ligaments, which is your short gastric artery. It is encapsulated with trabeculae. So the blood supply, it can either be the simple distribution type and the medusa-like distribution. Ano yung significance nito? Kapag medusa-like distribution kasi, ibig sabihin nito, mas madami siyang blood supply. Kaya nga, yung spleen natin is considered to be highly vascular. So anong mangyayari dyan? Pag tinignan mo siya, histologically, sobrang red niya. Ayan, no? This is your capsule, trabeculae, and then your connective tissues. Your connective tissue containing now your red pulp and your white pulp. So the blood flow, it can either be closed circulation. Ibig sabihin ng closed circulation, ito, okay? So yung blood mo nanggaling dito, and then magta-travel siya, babalik din siya doon sa veins, okay? So yun yung closed. Meron siyang dinaanang blood vessel. Ang open circulation natin, the blood is being dumped from the vasculature into the lymphoid tissue of the red pulp of the splenic cords. Ibig sabihin, dito lumalabas yung mga dugo. Okay? Lumalabas yung mga dugo para, diba sabi nga natin, siya yung graveyard ng red blood cells mo. Dito natatambay yung mga red blood cells for their demise. Kakainin sila ng splenic macrophages para ma-recycle yung mga contents nila like hemoglobin and your iron. Heme and iron pala, because heme and iron is your hemoglobin. So the white pulp, it is a small mass of white pulp consists of your lymphoid nodules and then periarteriolar lymphoid sheets with B lymphocytes and so it is made up of your white or central pulp artery. So ito siya. This is your white pulp. And then again, your red pulp, it is blood-filled. Ayan. It is blood-filled, and you can see here the splenic cords of Billroth. Okay? The splenic cords of Billroth contains your reticular fibers, lymphocytes, macrophages, and your plasma cells, as well as your red blood cells. Ayan. So the red pulp of the spleen with unusual endothelial cells called stave cells, and then this is your capsule, the outer layer of your spleen, and then paloob ka dito, nandito yung trabeculae mo, and then this is your red pulp, mainly consisting of your red blood cells. So the red pulp, you can see here your splenic sinusoids. So your sinusoids are elongated with endothelial cells called stave cells and allow separation of healthy from the affected red cells in the splenic cords. The function of your red pulp is that it serves as for blood filtration of the open circulation, which involves the interaction of your splenic cords to remove old swollen RBCs and which are unable to slip between the stem cells to re-enter the venous blood flow. So again, this is the graveyard of your RBCs, which now allows for the recycling of iron and for erythropoiesis. And then you also have your marginal zone. So one medical correlation for this one is your post-splenectomy or your OPSI. Ano ba yung OPSI? Overwhelming post-splenectomy infection. Okay? Overwhelming post-splenectomy infection. Ibig sabihin, tinanggalan ka na ng spleen. Okay? Natanggal na yung spleen mo. Anong possible mangyari dito? Ano yung substance na pinoproduce ba kasi ni spleen? 'Di ba? Kung naalala nyo doon sa discussion natin kanina doon sa membrane attack complex, 'di ba? Yung properdine, 'di ba? So yung properdine kasi it helps initiate the alternative pathway for its activation, for which it is useful in fighting encapsulated organisms. So kapag wala si spleen, wala kang properdine. Ang mangyayari, susceptible ka ngayon sa H. influenzae, Streptococcus pneumoniae, tsaka Neisseria meningitidis. Okay. So anong possible na management natin kapag natanggalan ka ng spleen para hindi ka magkaroon ng overwhelming post-splenectomy infection? Vaccine, okay? Babaksinan ka namin. Before ka umuwi, babaksinan ka ng isang doktor ng H-influenza vaccine, yung pneumococcal vaccine. Although wala namang vaccine yata sa meningococci, prophylaxis lang meron. Babaksinan ka para hindi ka ma-infection. Okay, you also have the tufsin, which enhances phagocytic activity. Okay? See. Another medical information is that although your spleen has numerous important functions in the body, it is not essential to life. Okay? Pwede siyang tanggalin and then you can still live. Like your appendix. Diba? So although the spleen has numerous important functions, it can be removed. Pero upon removal, ano yung mga makikita mo? Number one, since it is the graveyard of RBC, ano yung possible na mangyari dyan? Magkakaroon ka ngayon ng anemia, di ba? So possible anemia, pwede ding polycythemia vera, mga ganun. Kasi nga, wala nang tatambayan yung red blood cell mo eh. So, nasa circulation na lang sila. So, magkakaroon ka ng increased red blood cell doon. How about anemia? Kasi nga, hindi na mare-recycle yung iron mo and hemoglobin. Kaya nagkakaroon ka ng manifestation ng anemia. Decreased hemoglobin. Okay. So, dito din, as you can see here, ruptured spleen kasi siya yung number one na nara-rupture kasi kapag nagkakaroon ng car accidents. Bakit? In the positioning of your seat belts kasi, kapag nag-seatbelt ka, nakalagay siya dito. Okay, so kapag nagkaroon ng ng sudden preno, ayan, naiipit siya dito sa usok ng mga rib cage, ganun. So magkakaroon ng splenic rupture. Okay? And then lastly, your appendix. So your appendix is a blind invagination of the cecum. The appendix is a significant part of the mucosa associated with its lamina propria and submucosa filled with lymphocytes and lymphoid follicles. Before, sabi nila wala daw kwenta sa appendix. Pero recent studies show na nagsesecrete siya ng mga immunoglobulins. Bakit? Kasi marami din siyang mucosa-associated lymphoid tissue. Andyan, no? Kapag nakikita nyo, ganyan din yung mga lymphocytes yan. So it is short, small diameter projection from the cecum. Okay, so that's the end of our cardiovascular and lymphatic and immune system histology. I'm now ready to entertain questions. Sorry ha, medyo nag-extend tayo. Dami kasi.
No worries about that, Doc. And that was truly an incredibly informative session po. And thank you for that po. Now we'll open our floor for our Q&A session. So if you have questions, feel free to raise your hands or Send your questions in the chat box.
May magka-question ba?
Anyone? Sino may question dyan? Ayan, Doc. Doc,
Ano?
can genetics po ba influence the development of varicose veins? If ever po, can lifestyle changes outweigh yung genetic predisposition po? Thank you po.
Ayan. To answer your first question, yes, actually, the formation of varicose veins has a high link to genetics. So kung nakikita mo si mama at papa mo, may mga varicose veins sila ngayon, you can go to question number 2. Mag-lifestyle changes ka na, okay? Pwede mong maiwasan yung pag-develop niya. Hindi mo maiiwasan kumbaga yung pag-develop niya in the future, pero ma-lower mo yung chance of getting that one. So pwedeng mag-manifest pa siya kapag mas malalang matanda ka na, ganun. Pero as early as now, pwedeng hindi pa siya mag-manifest due to your lifestyle changes. Ano yun? Avoid, ano yung mga nakakaluwag ba ng ano natin, ng mga veins natin, di ba? Kapag hindi ka nag-exercise, kapag hindi masyadong active yung lifestyle mo, kapag nag-yoyosi ka or cigarette smoking, mga ganun. Okay, so yes, it can be influenced. It is influenced by genetics, and lifestyle changes can outweigh the genetic predisposition. It can manifest. You will not avoid the manifestation, but it can manifest in the later run or kapag mas matanda ka na.
Thank you for that, Doc. So, any questions pa?
Pangit din kasi ng varicose, di ba? Hindi ka na shorts. Although pwede pa rin naman, nasa confidence is the key pa rin naman. Pero yun nga, yun yung unang makikita kasi. Tsaka masakit siya ha. Masakit yung varicose veins na yan. Usually ang mga management na ginagawa namin dyan, kapag naka-admit yung patient namin, nakataas yung paa niya sa bed. Meron pa ba?
Anyone? Going once?
Kapag
Ayun, Doc. May
nagpapaskip,
dalawang question. Sorry po.
may chance lang bumalik. Yung sclerotherapy, yes, it's recommended for sclerotherapy is recommended for the management nga of varicose veins. For the recurrence, nasa sayo na kasi, sa aftercare mo kasi. Yung sclerotherapy kasi is more of the superficial lang kasi siya. Okay, so kung hindi mo na target talaga yung pinaka-inner na source, which is yung valvular involvement, so kailangan mo ng surgery para maayos yung mga valves, kumbaga. So may chance na bumalik siya after sclerotherapy. What role do immune cells infiltrate the pericardium in the pathogenesis of cardiac tamponade in the connective tissue diseases? Yeah, sige, going back to the sclerotherapy, kapag hindi natuloy yung sessions, gano'n ang cell. Oo, kasi hindi naman sa isang session natatapos yan eh. It needs to be, makomplete yung session mo para mas better yung better yung effect ng procedure para ma-strengthen nga yung blood vessel mo tsaka ma-minimize them. Pero kung yun, hindi mo siya tinatapos or hindi mo natapos, sayang din yung pera mo. Opt to go for surgery na lang din para magkaroon ng stents doon sa veins mo, doon sa paa para yun yung root cause kasi yung mga internal arteries mo hindi na ganun kalakas kaya nagsisip out sila. So why not ayusin yung pinakapunot dulo? Wait lang, hindi ko gets tong try ko munang i-understand. What role do immune cell infiltrates in the pericardium play in the pathogenesis of cardiac tamponade in connective tissue diseases po, Doc? Uh, you mean ba dito, what role the immune cells infiltrates in the pericardium play in the pathogenesis of cardiac tamponade in connective tissue diseases po daw? Yung cardiac tamponade kasi natin, okay, ganito ha. Yung cardiac tamponade kasi natin, nangyayari yan kapag, di ba, yung heart mo, meron siyang lining, di ba? Meron siyang space in between the visceral visceral layer and the parietal epithelium. So kapag nalagyan ng tubig yung mga nandun or nag-sip out yung blood, yun ba yung question mo? Paano nagsisip out? Number one is kapag may trauma. Okay, paano yung trauma kapag sinaksak ka sa puso, di ba? So yun yung cardiac tamponade. Nasaksak ka sa puso, magsisip out talaga yung blood doon sa space. Ano pa, yung mga possible na reasons bakit magsasip out yung blood doon. Kapag may fluid overload ka, ibig problems. Or kapag na-transfusan ka ng sobrang daming dugo or plain NSS tapos hindi mo siya malabas. Kapag kaya siya nag-sip out kasi nga yung backflow of blood nag-contract yung ventricles mo, hindi nalalabas lahat. So, saan siya bumabalik? Pumupunta din sila sa vasa vasorum, pumupunta sila sa cardiac arteries, and then doon nagdi-diffuse yung mga water. So, napupunta sila sa pericardial space. And then, ayun, nagkakaroon ka na ng cardiac tamponades. So, for the immune cell infiltrate, kasi nga, nasa blood din naman sila. Ayun, and then it also contributes to the inflammation na pwedeng mangyari doon. Yung role po ng immune cell infiltrates. Wala. Okay, role ng immune cells. Pwede, ganito, meron tayong sakit na tinatawag na rheumatic heart disease. Yung rheumatic heart disease, very good question. Yan, nagets ko na. Okay, yung rheumatic heart disease kasi, it's a type of autoimmune infection wherein your antibodies attacks the cells in your heart. Okay, so kapag yung immune system mo ina-attack yung cells ng heart mo, nasisira siya. So in the process of pagkasira, pwedeng mag-sip out yung blood through the pericardial space causing now tamponade. Pero that can happen kapag sa later stages na siya. Ang main manifestation lang talaga niyan is pagkahingal, ayan, mga cardiac abnormalities pa lang muna sa electrical system mainly. Okay, and then kapag napabayaan, kapag hindi ka nagtitake ng doses of penicillin mo, kasi yung rheumatic heart disease is initially caused by streptococcal infection na napunta doon sa heart. Kaya dapat magpaturok ka ng penicillin every 28 days or every month. Ayan, thank you for that one, Nayanik. Any other questions? Nandito pa ba si Doc Wills? Wala na.
Wala na po ata po.
Ano tong activity nyo na to? Para siyang reinforcement seminar.
Actually, Doc, hindi ko po sure kay Doc po. Pero alam ko po kasi is yung lesson po nila, revolve around this topic po kasi.
Okay. Ang nice naman na cardiovascular yung pinili, no? Talagang tinapat nyo siya sa Valentine's. Sige, I'll just send a copy. Meron pa bang question? Wala. Yung copy ng PowerPoint ko, send ko na lang kay Doc Wins, tapos sa kanya nyo na lang kunin. Sana na-gets nyo siya, no? Although, usually kasi kapag ini-discuss ko tong dalawang topic na to, dalawang session ako for cardiac, dalawang session for lymphatic. Kinat-short ko siya. Sa sobrang dami kasi. Kinat-short ko, tinignan ko lang kung ano yung mga pwedeng discuss.
Sige po, Doc. tingin na lang po namin kay Doc Wings po. Thank you po. Any
Wala na,
questions na po? I think wala na, Doc.
Thank you.
Okay, well, before we officially close, we would like to take a moment to express our deepest gratitude to Dr. John Michael P. Santos for generously sharing his knowledge and expertise with us today. So, as a token of appreciation po, we are honored to present this certificate. So, kawa lang po.
Gusto ni Stan ng mga kapag kinuha ko siya dito. Oo. Ano yung Stan? Capacity. Kasi ang nagkakalit mo, maisip, maili.
So,